professionally and personally as well, I feel you have done a lot towards normalizing the conversation and removing the kind of taboos or stigmas that are associated with it. You have breastfed during investor meetings. You have participated in a conference when you were in labor, I believe. And you won another conference when your child was 10 days old, and you've carried your babies around to conferences as well. You've done as much as you can to just normalize it. But recently, in an interview, I think you said that despite trying to look for reasons otherwise, I still find that there are a lot of obstacles that I face in my career that are still due to the fact that I'm a woman, which I find a very heartbreaking statement at the same time. So the question is, has anything changed since you started? Have we seen progress? Are we still, it's very slow and very gradual?
I think it's gradual but constant. Um, yeah, we've been making a lot of noise about women's health in the region since we started operating. There are, as far as I can work out now, significantly more panels, discussions, podcasts, questions on women's health. There are companies, more companies now, that are gently technology enabled, that have established themselves. My Lily Box, which is a period subscription company. There's Pective, which offers a more, I guess, kind of body friendly form of sanitary towel. There are other companies that are starting to see the space as an opportunity. My personal goal this year is to create a real sense of FOMO among the investment community about women's health. Because at the moment, I still think people don't really realize the market opportunity that it is. They don't believe the growth that we're seeing in other markets, such as the US and Europe. And we need that FOMO to exist, because until it's there, there won't be enough people who are seeking out companies to invest in, which means that not enough companies will come here. Do the barriers for women still exist? I mean, I have what do those barriers look like? I have conversations with women almost every single day about how they have decided to delay having families because they're worried that it will impact their career, especially female entrepreneurs. Um, and that suggests very heavily that there are still barriers here. I mean, this baby is due tomorrow, and I've been rocking up in meetings probably for the last couple of months to be received either with blank looks, even though I'm the only person in the room and there's absolutely nobody else who could be coming to meet this person for this meeting. And they still look at me, and I know that the first thing they see is pregnant woman. They don't even consider that I could be Sophie Smith, co-founder and CEO of Nabta Health, the person that they're meant to be meeting. Yeah, anything from consternation to genuine concern, and then all the questions about how they can help and should I be here and do we want to postpone the meeting? And yeah, in some ways, the investors that address the question head on are the easiest ones to deal with, because it's all there on the table. But yeah, of course, it's immensely frustrating. You feel like you get asked a lot of questions that force you on the defensive, and it's difficult to answer defensive questions positively. The answer I tend to give is, you know, like one investor recently, at the end of the conversation, said, "So Sophie, this is a personal question, and if you don't want to answer it, that's perfectly fine. But you've had 2 children, you're expecting your third. This is a company that's done a lot in the last 4 years, but it's in a position where it could grow very fast in the next couple. Do you really think you're up for it? Do you think you're the right person to run it?" And so then you have to explain, well, I've had 2 other children since the company was founded. We successfully raised one funding round. We've grown the company substantially in terms of our reach. We've created the kind of R&D that the region hasn't seen in our space to date. We've got a lot of partners on board. We're establishing partnerships with medical providers in the region, with one of the first, if not the first, consumer healthcare company in the UAE to do so. Look at all the progress we've made. There's nothing to indicate that this isn't going to continue, regardless of whether I have 1 or 2 or 3 or however many more children. And also think about who we're serving. At the end of the day, ultimately, we're serving women. And what do you think they see when they look at me from a non-investor standpoint? They see somebody who is living the company's mission, vision, and values. They see somebody who probably understands what they're going through, who they can definitely talk to about their concerns, who's likely to take their concerns and their points and their suggestions on board. And at the end of the day, you're serving your customers. You're serving your team and you're serving your customers. And yes, there are other internal stakeholders like your shareholders who you are working for, but it's the customers at the end of the day who matter. And so how I look to them is the most important thing. And as long as we're serving women, and I'm a woman, it can't be a bad thing.